And thanks for tuning in to Pregnancy Pearls with me, Dr. Plenty. Today, we're going to talk briefly about how do you recognize whether you have a blood clot in your leg or your lung. Collectively, a blood clot in your leg or lung is called a VTE, or venous thromboembolus. If you have a blood clot only in your leg, that's called a deep venous thrombosis or a DVT. If you have a blood clot that has migrated from your leg to your lung, that's called a pulmonary embolus. So stay tuned. We're going to talk about this in detail. And make sure to subscribe. Okay, so as some of you guys already know, I had a DVT, or deep venous thrombosis, which is a blood clot in my leg when I was pregnant. I did not have any risk factors. I hadn't done birth control pills before I got pregnant. I don't have a family history of having any blood clots. I don't have a clotting disorder, but I had a left-sided DVT, which is the most common side to have it on during pregnancy because you have your iliac artery that crosses over your vein, and the uterus compresses that as well. And so I had fibroids on my uterus that was compressing those vessels, which caused blood to back up down the leg, and that increased my risk for a DVT and actually caused a DVT. I then had the clot broke off, moved to the lung, and I had 3 pulmonary emboli. So, of course, I was followed by a hematologist, a pulmonologist, and a cardiologist, in addition to a maternal fetal medicine specialist and an OBGYN during my pregnancy. So I had a very high risk pregnancy. So let's talk about the symptoms of each one of those and how I actually recognized that I had it. So first off, a blood clot in your leg, or a deep venous thrombosis, abbreviated as a DVT, the most common sign is going to be swelling. And then after swelling, you can have a redness in your leg. Some people have a numbness and tingling, and some people have pain. And so for me, I had pain and swelling. I woke up that morning. I felt completely normal. I went down the stairs to go and get in my car, and I noticed that my leg felt really tight and sort of tingly. As time progressed, I actually went in and did a surgery that morning, and then went and got a lower extremity Doppler because I was having this. Now I could see the swelling, although it wasn't that painful. I went in and got a lower extremity Doppler, and they told me I had a blood clot in my leg, basically from my hip on down, which is pretty dangerous. So the symptoms I experienced: numbness, tingling, pain in my leg, although it was very mild, and swelling. I could tell my left thigh was a lot bigger than my right thigh. I am of darker complexion, so I didn't really see any redness, but in patients that I've diagnosed the DVTs in, I can definitely tell that their leg, one side is more erythematous, or that's what we call it, redder, than the other side. So there may be like a red hue to your leg, especially if you're a fairer complexion. So those are the most common symptoms. If you end up getting a pulmonary embolus, that means that that clot in your leg has broken off and it's migrated through your vasculature into the veins in the lung. A blood clot that breaks off into your leg and travels to your lung can be extremely dangerous because that can strain your heart and cause your heart not to get enough oxygenated blood to be able to pump out to the rest of the body. So symptoms of a pulmonary embolus, I actually didn't have many symptoms. Initially, I thought I had like acid reflux. I had like a vague chest discomfort on that left side. And a colleague of mine said, well, you don't have any risk factors for anything. You probably have acid reflux. And so, of course, my lovely sonographers went downstairs and got me some acid reflux medicine and stuff for indigestion. And it didn't get better. And so I had this nagging, gnawing pain that eventually got worse and worse. And that was actually a week before my leg was swollen. So I must have thrown tiny clots before I even knew that I had a significant blood clot in my leg that then threw clots again to my lung. So symptoms of a pulmonary embolus, it's going to be chest pain. Some people feel palpitations, like your heart's beating really fast. Shortness of breath is a really big symptom. And then some people, if you're really short of breath, can get very dizzy, you can get fatigued. Your pulse is probably going to be higher In pregnancy, the upper limit of normal is about 110. Most people that have a pulmonary embolus, their pulse is even higher than that. So you talk about 120, 130 even sometimes. So those are symptoms. And so you shouldn't ignore those symptoms, even if you have no risk factors. I didn't have any risk factors. So if you have swelling, you can't explain like why one leg is more swollen than the other, why you keep on having this pain. Please contact your OBGYN. Let them know what's going on with you so that you can be checked out. Let's talk briefly about risk factors. Now, I know I said I did not have any, but there are some people that are at risk. So you're at risk for blood clotting if you've had a previous blood clot. And that means that you should probably be on blood thinners during your pregnancy unless you have an issue with heavy bleeding. If you've had a history of a stroke, you're prone to clotting just in general. You have a higher risk of blood clotting. Pregnancy in general is a risk factor for blood clotting, and that's why if you have those symptoms, you automatically will get worked up for a DVT or a PE, as I said before. Oh, I forgot to add, obesity also increases your risk of having clotting by itself. Let's see, smoking. Smoking is a huge risk factor for clotting, and then compounded by pregnancy, it can make things even worse. So if you can stop smoking before you get pregnant, that would actually be of great benefit, not only for blood clotting, but also to help prevent risk of pulmonary issues in pregnancy and outside of pregnancy, reduce your risk of cancer, reduce your risk of having a small baby, and all the things that come with that. So smoking is a big deal, and it does increase your risk of having clotting in pregnancy, meaning in your leg or lung. If you've had trauma or a car accident, that increases your risk. And of course, if you have a clotting disorder, so if you have something like antithrombin 3 deficiency or things like that, factor V Leiden mutation, if you have first degree relatives that have had a blood clot, that would increase your risk as well. And you need to tell your OBGYN about those things. Treatment. So in pregnancy, you can be treated with either Lovenox or heparin. If you have been on blood thinners before, meaning like Eliquis or Rixtra, right now there's not a lot of studies with those, and so we try to weigh the risk versus the benefits. And so if you can't take heparin or Lovenox, then we might need to put you on some of those newer agents, but those newer agents aren't really studied as well. And so first line in pregnancy is either Lovenox or heparin. We prefer Lovenox because it's twice daily dosing to be therapeutic, as opposed to getting you on a heparin infusion, getting you therapeutic, and then trying to calculate the amount you need to be on. After the 36-week mark, some of your OBs are going to stop your Lovenox and switch you to heparin, especially if you're at increased risk for preterm labor or you have issues with contractions. Some people, if you have a scheduled induction or a scheduled C-section, will tell you to hold the Lovenox the day before your scheduled surgery or scheduled induction, and then you can resume it afterwards. You are more likely to get a blood clot after delivery than you are in pregnancy. And so the time where you are most likely to get a clot is the first through the third week postpartum. So because of that, if you've had a blood clotting disorder, or if you have a strong family history of clotting, then you will need to be on blood thinners for at least that 6 weeks postpartum period. Long term, if you get more than one blood clot in your life, that may mean you need to be on lifelong blood thinners. And that's only if that is unprovoked and not in the pregnancy. So if associated with just pregnancy, then you would only need to be on it during the pregnancy and then the 6 weeks postpartum course. But if you've had blood clots that are just because you walking around and you develop a clot, well, you probably need to be on something a little bit more long-term, even after the pregnancy, ongoing. But you should talk to your OBGYN and your hematologist about how long you should be on it outside of that 6 weeks postpartum period if you have something a little bit more complicated than just provoked PE or DVT in the pregnancy. Well, I hope that information helps. If you have any questions about DVTs or PEs in pregnancy, please email me at pregnancypearls@gmail.com. Also, make sure to subscribe to my Instagram page, which is pregnancy_pearls, and follow me on Facebook at Pregnancy Pearls. And of course, the YouTube page. Make sure you click subscribe below.